So welcome to voting list number 15, Monday, March the 17th. This is the Health and Government Operations Committee. We have a bill that was actually heard in committee that has been studied now for over a year in a work group. It is House Bill 1521, Delegate Woods, State Board of Social Work Examiners membership and examination requirement. It is favorable. The analyst is Lisa and the chair Rosenberg. Lisa.
This bill repeals the requirement that an applicant for licensure as a bachelor social worker or a master social worker pass an exam as a condition of licensure. An applicant for licensure as a certified social worker or certified social worker clinical are still required to successfully pass an exam prescribed by the State Board of Social Work Examiners. The bill also increases the number of members of the board from 12 to 14 by adding 2 additional consumer members.
And it's going to be actually Vice Chair Collison, because she has been attending the work group meetings and has the background. Vice Chair Collison.
Thank you, Madam Chair. So I want to make sure that everybody remembers the background on this bill. Last year, we had 2 competing bills that came in relative to the pathway to licensure for social workers. And one of them prohibited the use of the national exam. Now, this national exam is developed by a testing company based on information from, the experts in social work, and it's then delivered in states. And in Maryland, right now, social workers are required to take that, or potential social workers are required to take that test, and if they cannot pass it, they cannot get licensed in Maryland. As a result of the discussions that we had at the end of the session last year, we agreed to put a work group together that literally worked all interim long. It got a little bit of a late start because of appointments, but once it was started in the summer, they began to have robust conversations around the role of testing and what the appropriate pathway should be. This conversation was started because the National Board of Social Workers, American Social Work Board, ASWB, published a study 4 years ago saying that their test was racially biased, because the people who were people of color were not passing at the same rates as were their white counterparts. And I'm going to remind you all, I was in education for 32 years. I understand testing. I know what it's for. And this test that is being delivered and are being required is a test of memory. It's a test of basic, terminology. It is not a clinical test at all. In fact, I had a meeting with the leaders of the board, and they confirmed that for me, that it is not a clinical test. When you think about the skills that a clinician needs, well, it's important that they know the vocabulary and they know, the law, but this test doesn't reflect Maryland law. It reflects national law, which they learn in school. This is the thing. They learn these things in school, and they have tests, in school, and they have to pass the tests in their educational programs in order to get a degree. So the national test is duplicative. And the fact that it has been a barrier in Maryland has been very problematic for as long as I have been here. So the American Social Work Board argues that the test is essential to licensing because it standardizes expectations across the country. The bill does not say that no one can take the test. The bill says that bachelor's social workers, master's social workers are not required to take the test in order to be licensed. Clinical licensed social workers will continue to be required to take the test under this bill. There are a number of states that have implemented this prohibition in sort of the same way that we're doing it. It's 4 or 5. Illinois is the one that's had it the longest. What we hear from Illinois, and the chair of the work group contacted the leaders, the board in Illinois, which essentially said they have increased their numbers of applicants for licenses for social workers in the time since they've eliminated the test, and they've had no significant issues related to the fact that that testing is no longer required. So it's been a very difficult bill to work on because there are strong feelings on both sides, but the majority of the social workers who participated in the work group, and I'm going to say that again, the majority of the actual licensed social workers who participated in the work group, and there were, I can't give you the exact number, but at least 5 or 6, all wanted this bill. Now, there were 1 or 2 who said, no, you can't get rid of this test. We need this test. But the majority of them did. And for that reason, I feel like we are ready to roll. The work group is going to continue to do its work, and it will develop. It continues until June, right? Yeah. It continues until June under the law that we passed last year. And what it will do is work on what the alternative pathway to licensure is. I wish the Delegate Woods were here because I believe, and I'm hoping that I'm telling her story. Yes, she's excused. She's excused, right? Because she was the victim of the test and couldn't get a license in Maryland, so has been practicing in D.C. and practicing successfully. So I think that, there's an example. We have an example right here in our committee of what can happen. So with that, Madam Chair, I would move the bill.
Second. The bill has been moved and second. Delegate Hutchinson.
Madam Chair, you acknowledge that, the organization that does the testing does acknowledge that it is racially biased.
Yes.
Are they correcting that and looking to revamp it to become better?
They haven't for the last 4 years, but apparently they have something in the works for 2026 that they think will address the issue. I don't know how the content's going to change in that new test, but what they tell us is the test is going to be modular. So that and I don't know how many modules it will be, but for example, if it were 4 modules, then if somebody only missed one, didn't pass one module, then they could just retake that one module. But the issue with that is that still wouldn't allow the person to get a license in Maryland. And so they'd have to wait until they pass that module. So okay. I think, we're ready now to say that we're ready to move forward without it. But it's important to know that, and remember, if you want to be a part of the compact, the rules around the compact are you have to have taken the test.
Okay, that's my second part of my question. So that's still the issue. You can't, even though you are getting a license if you don't take the test. Is that correct?
Now, yes. But if this bill were to pass, you could get a bachelor's or master's level license without taking the test.
Understand. So, okay, so you are getting licensed, but the compact says even though you have that license, but you haven't taken the test, you can't join the compact.
Correct.
Okay, thanks for clarifying that.
Delegate Bagno.
Thank you, Madam Chair. And thank you for the work on this. I know it's been a long and winding road. Just to make sure, because I remember that this was a concern before with when we were having these discussions. This does not create a qualified license, which I know the concern was that if it was too discretionary and there was no guidance, that we could actually be creating a greater problem than we were solving. Is that correct?
That is not the intent.
This does not create a qualified license.
No. No, it is the same license as it is now, only there would be an alternative pathway to it.
An alternative. Okay, thank you very much.
Delegate Johnson.
Thank you, Madam Chair. So since they're not actually licensed, who is their oversight authority?
I'm sorry, I'm not,
Lisa, you want to go ahead?
yeah, yeah,
They're going to be licensed.
So they will.
Right.
The
They would be
masters and
licensed.
bachelors will be
By the board.
licensed by the board.
yeah,
Oh,
by our board.
By our board, okay,
Right.
gotcha, thank you.
Any other questions or concerns? All right, everyone's comfortable? Delegate Martinez.
No questions or concerns.
Yeah.
But just as a co-sponsor of the bill, I just want to really thank the advocates from SWARE on their relentless advocacy for this. Really, really proud that we got to this moment. I believe the Senate has already, the cross-file's already moved, correct? Or no? There's a separate bill that's moving, right? Didn't Mary
No,
Washington
just
have
us,
something?
just
Okay.
us.
Got it.
Yep. Just us. And it will go to the Senate, and my hope is that they would respectfully will consider it. I respect them very much, but this work has been done in the group, and these are the recommendations of that work group, right? And we often pass all these bills with work groups, and when they come out, they done the work, right? And have had the discussions as well, and the data is very clear, that with what the problems are. Delegate Hutchinson.
Here, so just to clarify, the board is still against the bill?
Yes.
Thank you.
Yes. Okay, any other questions or concerns? All right. Delegate Hill.
And what's the board's reason, after going through all this, that they're against it? Why is the board against the bill after going through all of this work group and stuff? What does the board say?
My impression is that they're following the lead of the national board and asking the board that we stay consistent with the national board.
Argument, I understood why our argument was it doesn't matter. Their argument is what? It's a racist exam, but we're sticking with it because what?
Because it keeps us in that national milieu. That's the only rationale that I can give you.
Does the national have an explanation of why they're, Delegate Hutchinson asked before, are they trying to change it? And the answer was no. I'm just asking what the national position, what's their justification?
They believe it's an important measure of competency for a beginning social worker.
In standardizing the process.
Right, and standardizing process.
But there are three, at least, what states have gotten rid of the test? Can you tell us? That we know of?
Illinois, we know, has got, and they've been the longest.
Illinois.
Right. Well, there are 4 states that have eliminated the exam requirement for 1 or more licenses, and this is from the ASWB. They're acknowledging it. Colorado, Illinois, Minnesota, and Utah.
All right. Any other questions? All right. Since it's favorable, we have had a thorough discussion. We have heard this before. All those in favor say aye. Aye. Any opposition, will you raise your hand? Delegate Hutchinson and Delegate Kipke. The rest of the members are actually in a meeting. They're having a meeting right now. The R's and Delegate Woods and Delegate Riley actually are excused as well. And some members are on their way. Thank you so much for being flexible and for having a very respectful discussion, all right? See you on the floor. Thank you.
We have another.